Hi, my name is Rebecca Navarro, and I'm going to be presenting on school-based mental health services and the impact of COVID-19 on disadvantaged youth. Okay, so here are some statistics that I found in my research regarding mental health in youth. A lot of these are going to be found in Los Angeles County, along with Service Planning Area 6, which consists of South Los Angeles. And that is going to be the focus of my project. So during COVID 19, 36.9% of adolescents in Service Planning Area 6 experienced mental health issues. Two-thirds of adolescents in Los Angeles County did not receive care for their depression, and 11.3% of residents in SPA 6 were uninsured, which this obviously affects the accessibility to care, especially mental health treatment, as 1 in 5 Californians are more likely to be pushed out of network when it comes to attempting to get mental health services. Okay, so here's the significance of the problem. So, the COVID 19 pandemic led to increased mental health disorders in adolescents due to factors such as social isolation, disrupted education, and the hindering of normal peer interactions. Adolescents in Service Planning Area 6 were disproportionately affected by these mental health disorders. Um, so, just in reference to that, like I mentioned before, 36.9% reported struggling with mental health in Service Planning Area 6 versus 27.5% in all of LA County. So, as we can see, they had higher rates of mental health disorders in that specific area of Los Angeles County, which is also why I did my project in this area. It's just underserved and they're affected at higher rates than the rest of LA County. So targeted interventions are urgently needed in SPA 6 to promote health equity and support the mental well-being of youth in this area. Additionally, I also wanted to add that the adolescents residing in SPA 6 face other barriers to accessing care, such as lack of insurance, being more likely to be forced out of network for mental health care, um, along with not being able to access the telehealth services, which I know there was a big rise in telehealth services during the COVID 19 pandemic. However, about 31% of residents in Service Planning Area 6 are considered disconnected households, meaning that they have no access to Wi Fi. Okay, so my EBP project question. In SPA 6 youth facing mental health issues affected by COVID 19, will implementing a partnership between mental health community organizations and local schools improve access to mental health treatment versus independently seeking healthcare services over a 1 year period? So, unfortunately, for my project, I couldn't actually implement it just because I got my preceptor about a month before school ended. So this is going to be a hypothetical implementation of my project. Okay, so for the review of the literature, the databases I used included PubMed, CINAHL, and Clinical Key. And then some of the key terms that I used during my literature search were mental health, youth, COVID 19, pandemic, adolescent, psychiatric disorders, community health, school based mental health services, schools, public policy, and public health. Okay, so here's a summary of my evidence. So the studies that were included in my literature search were systemic reviews, government reports, meta-analysis, qualitative studies, and longitudinal studies. Um, the population of the population included in these journal articles were adolescents that were represented in pre-COVID studies and during COVID studies, LA County residents aged 12 through 17, and students in grades 7 to 12. And then I also had community stakeholders, school based mental health counselors, mental health clinicians, and program administrators. And the intervention in these studies was the implementation of school-based mental health services. The dependent variables were mental health outcomes and program satisfaction, which was measured by participants' pre-intervention surveys compared to their post-intervention surveys. And the researchers measured the variables in a similar manner by utilizing surveys, although not all the surveys consisted of the same questions. So this varied from study to study. Okay, so the recommended best practice, according to the research I conducted, was the use of collaborative school community partnerships. These partnerships would essentially enhance coordination and access to mental health services, leading to more consistent follow through on health plans and interventions to address the mental health needs of the residents in SPA 6. Um, so the research also showed higher rates of mental health service utilization compared to independently seeking care. And school-based mental health interventions have shown to be more effective, especially in reaching these underserved populations. Okay, diving a little deeper into the research, um, it was found that youth with suicidal ideation were more likely to utilize medical care within the school setting when compared to primary or specialty care. So, more specifically, in one of these cohort studies that I looked at, the school based mental health programs were utilized by 42% of participants, which outperformed primary care services at 8% and specialty care services at 19.8% in accessing mental health treatment. So we can see that the school based mental health programs had much higher utilization rates than these other two options. School based mental health programs were also shown to have a positive effect on emotional and behavioral problems. And school-based mental health programs also eliminates barriers to accessing care, specifically the barriers that were noted by LA County residents, such as limited services, a lack of lack of information, shortage of mental health professionals, mental health stigma, transportation, and lack of coverage. Okay, so to address the growing mental health disparities among adolescents in SPA 6, a collaborative approach between mental health community organizations and local schools is recommended. So, this partnership would aim to expand timely access to mental health services and promote the overall well being among SPA 6 adolescents. And the reason why I decided to focus on schools is because most youth spend a majority of their time in schools, making them an ideal place for accessible mental health services. They also offer comprehensive support, as I had mentioned before, and no insurance is needed. And all of these lead to increased access to services for marginalized populations. Sorry. So, the policy for practice change. The policy that I wanted to implement was to address the growing mental health disparities among adolescents in SPA 6. A collaborative approach between mental health community organizations and local schools will be established. This partnership aims to expand timely access to mental health services and promote the overall well being of SPA 6 adolescents. So the protocol for this practice change, the procedure would be as follows: to collaborate with relevant stakeholders in order to establish a more coordinated effort, to develop comprehensive training modules for teachers, which would enhance their ability to identify signs of mental health issues and provide that initial support for students. Um, as well as partnering with local agencies like D.D. Hirsch Mental Health Services to ensure timely and specialized mental health support for identified at-risk students. And just to go give a little background to D.D. Hirsch Mental Health Services, this is a community-based organization that provides mental health services to underserved populations, such as those living in SPA 6. They're a nonprofit, so it's completely free. And they're also willing to train other professionals to increase utilization of things such as screening tools and psychological first aid. So they can help in providing the necessary resources to prepare educators and school staff and counselors to address the issues that they see in schools. Okay, and then lastly, to implement partnerships between mental health community organizations and local schools. This would bridge mental health gaps, enhance service utilization, and promote the well-being of among SPA6 adolescents. Okay, now moving on to the implementation plan. So, step one would be to address the relevant stakeholders. This would include district and school administrators, community mental health service providers, educators, students, and families, and establish communication channels and regular meetings between the stakeholders to facilitate the collaboration of the services and information sharing. So, step two would be collaboration with local health agencies. So, like I mentioned before, this would involve establishing a partnership with local health agencies such as D.D. Hirsch to provide specialized mental health services. And then step three would be to train teachers on mental health promotion. Um, this would involve designing and delivering comprehensive training for teachers, focusing on psychological first aid, mental health promotion, and the effective use of screening tools. This would be used to empower teachers to identify those early signs of mental health issues and to offer students initial support. And step four would be student support and follow up. Um, So, suspected students would receive timely access to mental health services from community healthcare agencies, as well as receive monitoring and following up on the progress and well being of referred students. So, the delivery of mental health services would be based on this multi tiered system of support framework, which is evidence based to enhance student mental health outcomes by providing academic, social, emotional, and behavioral support. So, this framework offers alternative approaches to addressing mental health issues in adolescents, which would be based on their specific needs and their acuity. So, tier one would be mental health promotion. And this would be done by school educators. So, all students would receive mental health services such as social emotional learning, wellness initiatives, and positive teacher student relationships, as well as positive behavior expectations. So now moving on to tier two, this would be the prevention of mental health problems as well as early intervention. This would be done by both school counselors or psychologists and the community provider. So, students found to be at a high risk for developing mental health issues or those experiencing mild issues would receive low intensity, individualized support and early intervention resources. So now moving on to the final tier, tier three would be that intensive treatment for the students that are a higher acuity or just have more needs in general. And then this would be done by the community provider. Let's say for this example being D.D. Hirsch. So, students with mental health issues causing moderate to severe impairment in functioning would receive intensive medical treatment, such as individual or family therapy and individualized education programs. So, an alternative approach to this is having the community provider come to the school and provide those services in school if it would be easier to the student for the student in case they have any transportation issues, or also going on their own time after school to the clinic. Those services would be available for them as well. Okay, so lastly, our evaluation plan. So the survey design would be to conduct pre and post surveys for student participants to assess the program impact. So these surveys would have four different sections. Section one would be measuring the psychological distress of students using the Kessler 6 scale. Section two would measure participants' feelings of resilience using the Pearlin Mastery Scale. Section 3 would assess the perceived need for mental health treatment, access to care, and perceptions of care. And then Section 4 would explore satisfaction, improve mental health, attitudes, and beliefs. And then for the analysis section, we would compare the scores from the pre and post program surveys and compare each section using a paired t-test to determine whether the program was a success and made a meaningful impact in the mental well-being of adolescents who participated in the program. Okay, and these are my references. Thank you for listening.